An aortic aneurysm is a dilation of that aorta. Remember, I talked to you earlier about the aorta as the charge vessel of the body. You charge it up like charging a crossbow. That's actually what it's called when you cock a crossbow. Charging the crossbow. Okay? But it turns out, in order to do that, you got to have bungee cords in the wall of the aorta, right? You got to have something that can stretch way out and then come way back. And it turns out that's actually harder than you'd think. The way that that's done is a balance of fibers called fibrin and elastin in the body, and this elastin molecule is not properly made in certain patients. Okay? People with Marfan syndrome, people with connective tissue disease, people with Ehlers-Danlos syndrome do not manufacture those elastic proteins well. The heart beats 30 million times a year, and that's the number of times the aorta has to expand and contract. Okay? If you have a genetic predisposition, your aorta is not well built, then over time you will rupture more and more of those fibers the same way you will rupture more and more of the fibers in a rubber band as you continue to stretch it out. Okay? Most people can make it through their entire life without this happening. Some people cannot. An aortic aneurysm is a big deal. What is the cardinal sign of an aortic aneurysm? It's going to be chest pain, okay? These are going to be people who have pain, and then everything else that they have about it comes from the mass effect of the aorta, okay? So this thing can bulge out. Anything over 5 to 5.5 centimeters is at risk for rupture and probably needs to be considered for repair. All right? The people who are most prone to get this are people with bicuspid aortic valves in the chest and people who are smokers for the abdominal aorta. Okay? All the other signs and symptoms of abdominal or thoracic aortic aneurysm come from that large dilation pressing on things. So up here you've got the recurrent laryngeal nerve that makes you hoarse. You have the throat, so you can get airway constriction or difficulties taking breaths. You can get wheezing. In the abdomen, you can get belly pain. You can get mesenteric insufficiency. You can get renal dysfunction if it's so large and it's near the kidney arteries. All of these things can occur. These are just some nice pictures of aneurysms. This is the more normal segment. This is the aneurysmal segment bowing way out here. So the problem with this is that there is something called the law of Laplace. And the law of Laplace says that if you put any vessel under a fixed amount of pressure, the larger the vessel radius, the higher the tension on that wall. Okay? All materials will rupture at a constant tension. Okay? So it's the same thing with your dive tanks for those of you who are divers. Okay? All materials will rupture at a constant tension. That's why there's a maximum fill pressure on your dive tank. If you want to go for more oxygen in the same size tank, you've got to change the material that the tank is made out of, or you have to get a bigger tank. Okay? The only other option is to change the thickness of the wall of the tank. All right? In the human body, you can't change the thickness of the wall. In fact, ironically, it gets thinner and thinner as the thing keeps dilating out, right? Okay. Alrighty, now, an aortic aneurysm can then result in an aortic dissection. This can occur without an aortic aneurysm, but it usually comes from an aortic aneurysm first, okay? We talked about that wall of Laplace. We talked about rupture of fibers under tension. What can happen is that under enough tension, you can rip a tear in the aorta. Remember, this is a pressure vessel, okay? It's under extremely high pressure, charged by the heart. That pressure is sufficient once you tear the inner lining of the aorta that the pressure can finish the job from there. Okay? So it's, I don't know if you guys have ever done this, it's tons of fun if you haven't. If you grab a really good knife and you just start at the top of a big piece of cloth, and you just stab the piece of cloth, you can just ride that knife all the way down. Okay? It'll break you all the way down, but you will finish rupturing that piece of cloth. It's tons of fun. You can get like 100 runs out of a single sheet. It's fantastic. So anyway, same idea here. Once you make that tear, that thing is going to keep going, okay? And it will finish the job all on its own if you don't intervene. So an aortic dissection is a crisis. It requires immediate and prompt intervention if it occurs in the chest. If it occurs below the arch of the aorta, many times medical management is more appropriate. But in the chest, you got a big problem. Because what's going to happen is that thing's going to tear back into the aortic valve and it's going to rip the attachment of the heart to the aortic valve, or it's going to rip those vessels. And what is it that comes off these first two branches of the aorta? You got it. You're going to stroke. Got a big, big problem on your hands. Make the call immediately. What's the cardinal sign of aortic dissection? Yes, back pain, back pain, back pain. Okay, if someone describes it as a tearing back pain, like some giant invisible being is literally tearing them apart like a piece of paper, they have a dissection until proven otherwise. They have a dissection until proven otherwise. They have a dissection until proven otherwise. If they are calmly telling you that they have this pain, they probably don't have this pain. Aortic dissection pain is usually incredibly intense. The patients are in agony. It hurts tremendously in the majority of cases, okay? There are exceptions to every rule, but that's usually how it's going to go, all right? So what you will notice if the dissection occurs between this vessel and this vessel, which is a very specific finding, is that you'll have a difference in blood pressure between the arms, okay? The only two things that on a test are going to give you differences in blood pressure are an aortic dissection and what's called a coarctation of the aorta, which is a pinching of the aorta right before that third branch right there, okay? Those are the only two things that are usually going to cause that. Okay? New murmur. If you have a new murmur, you are in all the trouble because that means the dissection has already made it all the way back to the aortic valve and it's tearing the aortic valve apart. It's opening up real wide. Neurologic deficit. Again, you lost the game already. They've stroked. They've dissected off one of their carotids and they've had a stroke. That's where the neurologic deficit comes from. Syncope, I guess. Again, if you have syncope from this, that means you've dissected into your carotid baroreceptors. You are in all the trouble, okay?